On question number 10, the Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. What recent reports has he received on access to elective surgery?
Honourable Tony Ryall.
Mr Speaker, I've received many reports, two of which I think are worth sharing with the House. One report confirms that the number of patients receiving elective surgery has increased from 118,000 people a year under the previous government to over 158,000 patients a year now. That's an increase of 40,000 patients a year. The other report is yet more good news in elective surgery. I can confirm that the government has today announced an extra $10 million will be spent delivering almost 2,000 extra operations.
Supplementary question, Mr Speaker.
Supplementary question.
This question is
Order.
motivated the Minister.
I call the member to ask the supplementary
Thank you, Mr
question.
Speaker. How has he arrived at the number of 1,800 more patients to receive elective surgery as per his announcement today, when specialists are saying there is huge unmet need, and why won't he agree to an independent scientific measurement rather than this sort of regular drip feeding of funding in an effort to close down criticism and debate?
Honourable Tony Ryall.
Mr Speaker, the government's investing into that extra 1,800 operations because of careful management of the health budget. We've been able to free up resources to help those patients. This government has made elective surgery a priority year after year after year, and have been criticised by the opposition for doing so year after year after year.
Supplementary question, Mr Speaker.
Supplementary question, Honourable Annette King.
Why was he so fast to dismiss and denigrate recent research undertaken by TNS, which found 280,000 New Zealanders meet the clinical criteria for elective surgery, but only 110,000 have been placed on a waiting list, leaving 170,000 patients living with pain and disability, when the Ministry of Health found TNS research reliable enough to undertake the New Zealand Smoking Survey, information which he is quite happy to quote and crow about.
Mr
Honourable
Speaker,
Tony Ryall.
Mr Speaker, because the survey was commissioned and overseen by the Health Funds Association, that's the private health insurers of New Zealand, who want to jack up as much business as they can. I understand that the private health insurers and the private hospitals are under pressure. When the government increases the amount of publicly funded surgery from 118,000 operations a year to 158,000 operations a year, I can see why they're concerned.
Point of order, Mr Speaker.
Point of order, Honourable Annette
Mr
King.
Speaker, I seek leave to table a document from the New Zealand Smoking Monitor, very difficult to find on the website,
Order.
but it shows the Ministry of Health were prepared to use the research from TNS.
Order. Order. The member's now trying to use the point of order in the tabling of document to make a political
Supplementary.
point. Supplementary question, Dr Paul Hutchinson.
Thank you, Mr Speaker. To the Minister of Health, why has the government made such a commitment to increasing elective surgery?
Mr Speaker, that's an excellent question. The government inherited a very difficult situation in elective surgery, where between 2000 and 2005-06, the health budget increased significantly, yet the number of patients getting surgery was actually slashed under the 6 years of Annette King. Waiting lists were culled, 30,000 people were removed off the waiting lists for no reason other than the fact that the minister wanted to dress up the waiting list. That's why we've worked so hard. 40,000 extra operations a year. What a great effort by the doctors, nurses and hospitals of our great New Zealand Public Health Service.
Supplementary question, Mr Speaker.
Supplementary question, Honourable Annette King.
Thank you, Mr Speaker. Is Mid Central Health one of the regions who have thousands waiting to get on a list for surgery in light of a recent report from their Hospital Advisory Committee, which states they can no longer give certainty for treatment within 5 months to those patients, that there is significant concern about it, and one board member said publicly that patients will continue to be in pain for a longer period of time and the pain won't go away.
Honourable Tony Ryall.
Mr Speaker, I know that the Mid-Central District Health Board will be benefiting from the announcement that we've made today, and in fact, compared to when Labour was in office, 5,400 more patients have been treated for elective surgery at the Mid-Central District Health Board. I think they're doing a very good job, and I would expect more surgery to come.
Supplementary question, Mr
Supplementary
Speaker.
question, Honourable Annette.
Will he give a commitment today that when DHBs are required to shorten waiting times for surgery to 4 months later this year, the threshold to get surgery will not be lifted and more patients pushed out of the system, as some specialists are predicting is likely to happen? If not, why not?
Mr Speaker, I can give that member the assurance that it's always been this government's intention that we shorten waiting times by increasing the amount of surgery that is provided. That is the reason why that there are 40,000 more operations done in the last 12 months compared to when we became the government.
Point of order.
Mr Speaker,
Point of order.
Mr Speaker, I asked the Minister whether DHBs would be lifting the threshold for surgery. He went nowhere near that question, and that is the guts of the question.
Order. The member now cannot insist on an answer that she so desires. The question was wider than that, and I rule that the Minister has addressed the question. Further supplementaries? Otherwise, question 11, Simon O'Connor.